Yeah.
Okay.
Right. So if you've read and understood, considering it surgical anatomy station, please tell me how shoulder joint is formed.
Okay, shoulder joint is formed by articulation of glenoid of the scapula with
Yes.
the head of humerus,
And
and also articulation between the acromial end of the clavicle and the acromion of the scapula. So the acromioclavicular joint.
yeah, but then there is glenoidal cavity and glenoidal labrum as well. All right.
Okay.
Yes. Right. What type of joint is shoulder joint?
It's a pull and socket joint.
Type of synovial joint. Okay.
Yes.
Right.
Okay.
Please tell me what are the movements which are possible at shoulder joint?
A wide range of motion, including flexion, extension, internal and external rotation,
Yes.
abduction and adduction, and circumduction.
Right. Please tell me what are the structures which are attached to the coracoid process.
It includes the ligaments and tendons. Regarding ligaments, coracoacromial ligament, coracohumeral ligament, and regarding muscle, it has insertion for pectoralis minor and origin of coracobrachialis and short head of biceps.
Right. Okay. Your task was to examine the shoulder joint. So please tell me at which level or at which position shoulder joint is most or least stable.
Uh, it isn't stable at all because it is, I think, with
There are
abduction and external rotation.
there are 3 points you have to tell when shoulder joint is less stable. So if you don't know, we can come back to this question later, right? Please tell me what kind of image are you looking at? These marked
It is
structures
a,
represent what, please?
yeah, it is a cadaveric image for the shoulder joint.
Okay, is it shoulder joint?
Uh, I think
No.
it is for the axilla.
Okay, axilla is here, but something else is shown as well. Please pay close attention to it. These are the brachial plexus.
Yes, yes.
Right. Please tell me the surface anatomy of the brachial plexus. How would you draw
Uh,
it on a human being? If you've been given a pen and a human being in front of you, how would you draw it?
okay, it starts with the roots of the brachial plexus. It in the posterior triangle of the neck.
Okay, but roots
Uh,
are not visible. You won't be able to see the roots. Then roots, after
no.
roots, then
Then trunks
yes.
uh, over the first rib. Okay,
Okay.
and then divisions.
Yes. Where exactly divisions are located, please? Behind the middle third of the clavicle. Are you there?
Yes.
Yes, yes. After divisions, there are chords.
Branches.
Chords.
Chords. Yes.
How many
Yes.
chords are there, please?
Yeah. Three chords.
All right. And
Medial, lateral,
yes.
and posterior.
What is their relation to the axillary artery, and in which part of the axillary artery exactly?
They are related to the second part of the axillary artery.
Yes, and that's how they
Let,
are named.
sorry?
That's how they are named.
Yes, yes.
Yes, right. Now please tell me the branches of the cords.
Okay, regarding the medial cord, it have 5 branches. Medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm,
Good.
musculocutaneous nerve, uh, medial part of the median nerve, and ulnar nerve.
Okay, and the lateral and the posterior cord. They give
Uh,
quickly.
lateral, uh, lateral pectoral nerve, and
Yes,
lateral root of the median nerve.
yes, and
Uh, regarding the posterior cord, it have the axillary nerve and the radial nerve,
yes,
upper subscapular nerve, and lower subscapular nerve,
and the
and
medial
thoracodorsal
pectoral nerve. Okay, this musculocutaneous nerve is branch of which cord?
branch of the it is the terminal branch of the lateral cord.
Yes, good, very good. Okay, please tell me, right, what are the possible, like considering the fall of this patient, what are the possible injuries that can occur to this gentleman?
Uh, I think it is traction injury, so it may be Erb's palsy,
All right.
affection of upper roots C5 and 6.
Yes, when you examine the patient, what motor and sensory loss you should see there in order to appreciate the injuries of the person?
Okay, regarding the motor injury, it will be shoulder abduction, internal rotation, elbow extension, pronation with wrist flexion. It is called the waiter's tip deformity.
Yes.
Uh, and regarding the sensation, it will be sensory loss over the
Okay.
lateral aspect of the forearm.
Arm and forearm,
Arm and the
radial.
forearm.
Yes,
Yeah.
very good. Okay. We are moving forward. You told me. All right. What type of joint is this? Number 3.
Uh, it is the elbow joint.
How is it formed?
Sorry?
How elbow joint is formed?
Uh, elbow joint is formed by 3 articulations. Articulation with the capitulum with the radial head,
Yes.
and also articulation of the trochlea with the trochlear notch of the ulna,
Yes.
and articulation with the olecranon process of ulna with the olecranon fossa of humerus.
Okay. What type of joint is elbow joint?
Uh, it is
Synovial
synovial
type
joint,
of hinge
synovial
joint. Hinge joint. Okay, please
hinge.
tell me how many compartments there are in the arm here.
Uh, in
How
the
the
arm, I
muscles,
think.
yes, the muscles
Sorry.
of the arm, how the muscles of the arm are structured.
Uh,
Okay, we can
it
come to
is.
that later if you can't
Oh,
recall.
okay.
If you
Hmm.
can recall, please tell me quickly.
I think it is anterior compartment for the flexors and posterior compartment for the extensors.
Okay, please tell me.
And
Right.
the
Yes.
anterior compartment is superficial and deep, I think. No, I can't get
No,
it. Yeah.
you're getting
Yeah.
confused. All
Yeah.
right. Okay, please tell me. Right. Where exactly spiral groove is located? I'm moving my arrow because I don't want to confuse you.
Spiral groove. is including the posterior aspect of the humerus
Okay, what passes through it?
between the radial nerve
Yes, and
and profunda brachii
very good,
vessels.
very good. Okay, if a person, most likely a child, less than 12 years or around 12 years of age, falls and has a shift of humerus fracture, most
Okay.
likely susceptible. What will be the clinical features with which child will present?
Okay, regarding it may be the supracondylar humerus, yes, or we are asking about the mid shaft of humerus fracture.
Mid-shift of humerus
Yeah,
fracture.
yeah, mid shaft it will affect the radial nerve.
Very good.
Uh,
Tell me the
so
loss. Yes.
and it will presented with loss of extensors, so it will has
Very good.
wrist drop
Wrist drop and
and hand drop.
very good. And there'll be loss of sensation where?
I think in the anatomical snap box.
First web space. Very good. But do not
First
use
of
the yes, do not use the word I think, because you know it. Be concise and
okay.
please tell me, this is the last question of this station. What kind of image are you looking at? And identify the marked structures, please. Hello? Are you there?
Hello.
Yes, please. What kind of image are
Wait,
you looking at?
it is an MRI for the shoulder joint.
Okay. Please identify the circular structures. What is one?
One is acromion,
Four, please.
clavicle,
Five, please.
deltoid,
And arrow pointing at six. What exactly is it?
glenoid labrum.
Cavity.
Glenoid. Yeah,
Yes.
glenoid cavity.
Seven is glenoid labrum. Please give or tell me indication when exactly would you ask for this imaging?
Sorry?
Voice is someone's. Please tell me indications when you will ask for this images or this kind of imaging.
We can ask it if we have injury of the rotator cuff muscles of the shoulder.
All right. And you would have to rule out what?
To rule tear of the rotator cuff.
Rotator cuff. Okay, one. And there are many other indications as well. And I expect you to tell me at least two more. Okay, time has gone, so you can tell me tomorrow. Good.
Okay.
Right. Thank you.